Should get started. So, my name's Megan. I'm with Camp Quality Michigan North, and I'd like to introduce you tonight to Dr. Kay Wagner and Dr. Mary Ellen McKnight, both who work in the oncology realm. And they are going to lead us in our Pediatric Oncology Camp Health Provider Roundtable tonight. And let me get my screen off for you guys. There you go.
Hi, everyone. Thank you for joining
Hi.
us tonight.
Thank you, Megan.
You're welcome.
Hello.
Hey, Teresa.
Hello.
I'm just looking through the list of folks we've got on here. Looks like we've got a good group. All right, so I think we'll go ahead and introduce ourselves just in case you don't know us. I am Kay Wagner, Dr. K at camp from Camp Bring It On. I'm a pediatric oncologist in South Dakota and currently have the privilege of serving as the president of the COCA Board of Directors.
And I'm Mary Ellen McKnight. I am just recently got my doctorate in nursing practice. So that's huge. You know, the student loans are going to start really soon, which is fine. And I am known as Ms. McKnight at camp because it's just a thing. I don't know why, but anyway, glad to be here.
All right, so we want to make sure that this is an interactive, good time for people to bring things up. Does anyone have question, topic they want to throw out to get us started? Everyone's either trying to maybe eat dinner or a little bit of post-dinner.
So I know this is going to be a session tomorrow, but has anybody thought about restructuring medication administration in thinking about distancing, but also thinking about if we don't have as many nurses available as what we've usually had?
I have not crossed that bridge myself yet. I'm curious if others have.
I know at our camp with Mary Ellen at Case Camp here in Delaware, Mary Ellen and I are the ones that do the meds. And we send our nurses out with our cabins to their activities for like a first aid, just in case safety thing. And I guess this year, if we are going to be in person, they probably will be the ones that will police the masking and the social distancing and watch that everyone's using their hand gel. But medication for our camp would just go on the same as we've always done.
Yeah, and we did leave ours the same this year. The only staff I didn't cut down in numbers was the medical staff, because we had the space to be able to still have them room and distance and all the stuff that we needed to do. And I felt like we needed the extra manpower, and I was very right about that. We did need the extra manpower, but the differences we did have is previously, you know, it's pretty cold at like night, especially morning and night. They would all huddle inside the med shack and come get their meds. And that was discouraged. And we would have them wait outside distance in their groups. And they would all have to kind of just come up together and then do that. So we did space it out that way. But other than that, we didn't feel like we could do a lot of changes and still keep it safe. But that worked well, and we were pretty comfortable with it.
So you kept your campers basically in their own groups and had them come get their meds as a group rather than going out to them with the meds.
Yes. Yep.
Okay. How about other folks?
You know, we changed things a little bit this past summer at Camp. And, you know, it worked for COVID, but we had actually planned to make this change already because we had our brand new healthcare center that was not completed yet in 2019. And so since we were virtual in 2020, 2021 was our first chance to actually use it. And we designed it well, and it has huge wraparound porches. And we had always planned to do med admin on the porch of that building. Previously, what we had done is most of our med times are before meals, and the healthcare volunteers would take the meds from our old infirmary over to the dining hall and then have stations around the porch of the dining hall. But then, you know, when you have a liquid med that gets spilled, or you have, you know, someone who refuses a pill and spits it out, because we serve a lot of campers with developmental disabilities. Then if you only brought the one dose for that mealtime, you had to go all the way back over to the infirmary, get another dose, all of that. So we had always planned to re-centralize, I guess, medication administration right there outside the med room. Luckily, we did build these 16-foot wide porches on 3 sides of the building that allow us to have a picnic table for each cabin group, and they can be distanced when they go to get their meds. So it worked out really well for us, but we would have done some version of that. We might not have worried quite as much about the distancing as we did this past summer. But it was really great. And I think yesterday I talked a little bit about the changes we made in check-in and sort of decentralizing check-in. So we sort of re-centralized men, but we decentralized check-in so that we took the meds at the cabins. But we, for a long time, have stayed away from taking meds to the activities because when we used to do that, which was even before my time, and I've been here almost, well, this was my 14th summer, but when they used to do that, they used to have a lot of med errors. They would get the wrong kid. They would, you know, different things happened. And so we like doing it where the kids come to our healthcare staff at a designated station. It just seems to be a little bit more controlled for us. So, and again, we're serving a little bit different population because of the developmental disabilities that we serve as well.
For you guys that have the campers come to the med shed, do you make the whole group come, even if they don't all have meds, or just people within the group that have meds?
We had people just within the group, like you had, because we had enough counselors that they could keep. So the campers that didn't need to come up would be in one group. The campers that did would be in another group. But then once they were up there, they had to stand on the porch in their cohorts separated.
The way we did it this summer in particular is for breakfast meds. Everybody came because we also did temperature checks and you know, some of the other sort of daily symptom checks then. And then only those who needed meds came at lunch. Always 3 o'clock meds are only those who need them, or 3:30, it's right at the end of rest time. Dinner meds, just those who need them. And evening meds, we have everybody come just to get sort of another sort of symptom check, but just so that our healthcare volunteers are laying eyes on the kids at the end of the day, because we have historically had 14-year-old volunteer counselors who are serving as buddies with our campers with developmental disabilities. We always have those who are college age and above who are the leadership in the cabin, but still we just like having the med staff lay eyes on the kids at the end of the day and make sure that their trained eyes are looking for sunburns and things like that. So we do soap notes at the end of the day.
Anyone else?
Another idea. So we have our nurses are out with each cohort or with the programs. And so they passed meds within the programs at mealtimes. But you know, we actually had our medical office was outdoors this year. We put a big tent over the patio. So you could definitely have the kids outdoors while you're doing meds and still be covered if it's inclement weather or whatever. We did some exit testing. And so we had the cohorts come. We had about 10 Adirondack chairs set up spaced apart on the lawn by the medical office, and which you could do the same thing for meds. And the kids came, they came cohort by cohort. You could do the same thing with meds and just pass out meds that way, and then just spray the chairs down with a disinfectant sprayer as they head off and you get the next group in. So if you don't have the staff to be out in the groups, I think that would be finding a way to set up a tent that's covered with chairs spaced apart and bringing them in. This is the time for this cohort. And we use the radios. We said, we're ready for cohort A, we're ready for cohort B. And people were there when they were supposed to be there. So it was great.
Thank you.
Thanks.
Kat, I know you had your hand up. Not sure what question or idea you had.
Was that for me?
Yep.
I forgive me. I thought was this session number 2?
Uh-huh.
Okay. Was there a quick review of what was done in session number 1 for those of us who weren't there? Maybe just a quick overview, because I haven't had a chance to look anything. Just a very high level what was talked about or what people got from that.
Well,
Yes,
Dave, that would have been a good idea. We just jumped in. You should have had a suggestion 10 minutes ago.
I did. I had my hand up, but everybody was talking so well. I didn't want to interrupt. It was all, I could wait.
There was a lot of good discussion yesterday about COVID. We followed Dr. Raffi's talk, which was incredible. And so we did have some really good discussions on what type of protocols we put in place in preparing for camp, testing before, what kind of testing. And then also we got to share a little bit about some of the family programs that they had and how they did those in the context of social distancing. And yet it sounds like it was a great, it just went really well. So Brandon was a great contributor with that conversation yesterday, as well as Susie. So it was a good talk.
For those, this is Tammy from Camp Fantastic. And for those people who have put together these programs and stuff, because one of the things we've been virtual, completely virtual. I want to think that we're going to have camp next summer, but every time I hear about Delta Plus and all that stuff, I start to get kind of nervous. But I'm hoping with the vaccinations and stuff, we're going to be able to do it. But I guess with all of these people who have been working so hard on putting protocols together and stuff about how to deal with COVID, and I realize it's individualized for each camp, but is there a repository? I know they talked about with COCA having, some CEU stuff. Is there a place where we can have everybody that's willing to share their protocols and stuff, upload them so we don't have to recreate the wheel on some of the stuff?
We do it for gold ribbon recommendations as far as, if people have policies that they can use, we upload through the portal. I'm sure we could do something similar. Whether it'll be under like the education site or where it would exactly live, I'm not sure, but that's absolutely something we can talk to Don and Jennifer about, because I think you're exactly right. If people have found things that work, why, and are willing to share them, why do it all from scratch if you can at least build off of what someone else has done? Or maybe people can say, hey, this is what didn't work, so don't spend your time trying that. So
well, and even just I think a COVID repository would be great, because there's so many aspects, not only for program directors but med staff and just general ideas. Because I agree, the stuff for the gold ribbon was very invaluable for some of the policies that we hadn't created yet that we wanted to work on. So with COVID, I think it would be really helpful.
That's a great idea, Tammy. And that's actually been something that's been on Dr. K and my radar, is kind of doing a best in practice for oncology camps. So that's definitely something we'd really like to delve into and see if we can't, get a pretty good comprehensive set of resources for everybody.
Yeah, that would be great.
yeah, we'll take that back and figure out where's the best place for it to go, and then we'll let you guys know. So I think if nothing else, periodic updates from Dr. Raffi could live there too, because that was a really great talk that he gave as well. So
It was very good.
Dr. K,
yeah,
among your physician colleagues across the country, I know we talk about so many things at COG, so camp probably isn't primary, but do you get a sense of what oncologists are thinking. I mean, we were willing to go for it from a staff and a nursing perspective, but, or at least to try something, but it was our oncologists that weren't comfortable.
Yeah, I think it's kind of across the board, just depending on what people's own opinions are. But when I think about it, because obviously we discussed this both for our camp and for this conference and everything else, it's so hard to risk our kids, but then at the same time, our kids are so used to having to be careful and wearing masks and doing those things. So if there's a group that you're going to be able to ask to follow some of those rules, this is probably a group that you could do it. But, the thing I think I'm a little bit more, I don't know if concerned is the right word about, or to say, but that's kind of been on my mind is really our staff and our volunteers. This always comes up with immunizations and what you can require people to do. So we're back to, can you ask your staff and your volunteers to be vaccinated? And what does that look like for a workforce for you? So, because, interestingly, I work here in South Dakota, and we were relatively early in doing vaccine mandates, and it really caused quite a bit of division. We had protesters outside the hospital, and was really not an easy topic to tackle. So I'm not sure how that's going to go if we feel that we need to make that a rule for camp. I feel a little easier saying it for the campers, but that's because I spend my days giving recommendations for them. Adults are a little different decisions. So that was a long way of saying, I think you could probably ask, a different oncologist and get a bit of a different answer. But my instinct is that still, at least before the vaccines were out, most of us were a bit cautious. I don't know if that will change now with the, pretty much age range of camp covered with vaccines or not. But I would like to think, yes, that we'd all want to get back to doing this great camp experience.
We did require vaccines for our staff and volunteers for summer camp, and then highly recommended for our campers. This for summer, we had about, and if they didn't want to, we had our virtual programs that people could participate in. So they still had opportunities within camp. Our age eligible campers, with just some strong recommendations from us and letters, we had 71% of the kids were vaccinated that were age eligible, which was fantastic. We did come out with requirement to come to our winter camp if we end up proceeding with it, and we'll see what the numbers are doing. They were going down, now they're upticking a little bit. We are asking that our campers be vaccinated for COVID-19 to attend that in-person program. So far we've only had, we've had about 40 kids apply. 4 are not vaccinated against COVID. Everybody else had already been vaccinated. So of the campers. So seems to be a large number, at least at this point.
Can I ask a question that's somewhat kind of in the point that Susie was just talking about? How did you guys go about, if you did require it of your staff, how did you go about asking that? Did you just lump it in with, are your immunizations up to date, and give examples of what you mean by that? Or did you specifically identify and ask about COVID as its own question?
We just stated that in order to participate in that program, when we sent out this summer camp is open, applications are open, et cetera, we just put a statement in there that would be required in order to attend the in-person. So, and then we did include some COVID questions in our health history for both our volunteers and our campers.
Thank you. We, in Montana, we're kind of in a tough situation. Our governor has passed a state law that we can neither ask about any immunization, so not just COVID. We are not supposed to be asking about immunization status for anything, nor can we require it to attend our programs. So I appreciate kind of a sense of how people asked that. So
Did you say you're not allowed to ask about them at all?
nope.
What do they do with schools?
I think so. There's like certain within the law, there are some exceptions, and I can't remember where the schools fall in with that. But we've specifically been having our attorneys look, and we do not fall within the exceptions. So.
Because in
Makes it
Wisconsin,
really-
camps are kind of thrown into the same requirements as schools, so we're lucky there.
Yeah, I'm
That's
thinking
kinda
back to,
scary.
if we remember what was happening right before COVID was measles. And, you know, we were all up in arms and everybody was trying to figure out how to require, and we were able to require that. But now, if we can't even ask about measles, that's going to be really tough, because I think at least in Virginia, we haven't had that problem yet. So we're planning on making it a requirement, and they have to, you know, we have several specific, we want their immunization records to be all up to date, but we have very specific ones that we track to make sure that they have those before they come.
I don't know what you do there, because we very specifically asked about, well, we said COVID, are you immune to COVID? And then put the definition as having, you know, the vaccine series completed greater than 2 weeks prior to camp, or having a COVID positive documented infection greater than 90 days, or I mean, not greater, within 90 days prior to camp, or greater than 2 weeks. And they had to say yes or no to that. I don't know how you would do it if you can't ask that. And I don't know, you know, the only people that were, I mean, this was part of our culture that we created too, but the only people allowed to ask the question were the medical director and executive director. But it was on our medical intake form too. So if you happen to be the medical provider that was intaking that person, staff, volunteer, camper, then you knew because it was on the form. I don't know. Yeah, that feels hard.
So,
You know,
so would you require testing then before they come?
We did. We required tests, a lot of testing from everybody.
And how often do you do that?
So ours, because of our, and I'm talking about this more tomorrow, but like ours, because of our disbursement of where people are coming from, we were in places where getting testing was hard at best. And so we had a whole series of like, you had to get tested within 7 to 10 days. And then again, in less than 72 hours. And then upon arrival for campers. But they did that because our legal counsel told us we could not require a vaccine. We could not require immunization for our staff or volunteers. And so we felt like we had to kind of buffer it a couple different ways. I will say, kind of turning it into a competition of like, we were allowed to put a percentage of how many, like what our immunity rate was, which could be infection-based or immunization-based. So we put that in and made it kind of a competition to see like who could get there first, but we couldn't require any of that.
And do you retest once they get to camp? Like after so many days, how long is your camp?
There's is a week for each session. And so we didn't retest once they got there. Like they got there day one, they got tested. But then we didn't retest unless there were any sort of symptoms. Or if like we had a staff member who, for whatever reason, had to leave and come back, they would get retested. Which the only reason any of our staff members left were because they were doing all of the sessions and needed a period of time off.
Did you house vaccinated and non-vaccinated together or separately, or did you approach housing differently?
We lucked out. We thought about that and we thought we were going to have to do that, and ended up having enough vaccinated and immune staff that it was really not a huge concern. We were pretty well buffered. So we did not end up worrying about that, but we did think about it and talk about it.
The other thing I was going to add too, I'm Becky, I work at the same camp as Jamie. We tested regardless of vaccination status. So all of the staff had to get a PCR and a rapid test, the PCR being within 7 days and the rapid being within 24 hours, and then campers as well.
We did the same, Becky. So we had the vaccination, but we also, and I think it goes to the point that Dr. K made, is that these kids are, you know, high-risk kids. And so you want to put every layer possible in place to keep everybody safe. And so we did a PCR 3 to 5 days before. We did a rapid antigen on arrival. And then they only stayed for 3 days, but we did a post and exit test just to kind of be able to say, hey, we did this and we did it successfully. We did not have any cases of COVID in either session. So
Who paid for your testing?
So we actually, camp did. So a lot of the testing was covered by insurance, but we decided to work with a consulting healthcare group to take care of all the insurance kind of stuff for us. So we paid, so much per camper, and then they managed all that reporting and all the submission to insurance through the labs that they used and things like that. So we did not have to pay for any tests per se, because they were all picked up by insurance, other than I paid $5 for each rapid antigen test. At that time, Abbott was given a big deal. Now Abbott's upped their prices on the rapid antigens because they're in short supply.
Ours was all paid by the Utah Department of Health. So we had, for those that work, because we have like Idaho, Nevada, Utah, Wyoming, and then we had a couple from back east somewhere, I can't remember where. Those people we offered to pay for a testing organization to send them a test, but they all found their local health departments and had success getting those covered either with insurance or just through the Department of Health.
And we could have gone through like Wisconsin for the kids from Wisconsin, but we had like 3 states involved, and it was just much easier just to have one person managing. But I was looking at that, could we get free testing from Wisconsin Department of Health and free testing from here? So I think if you're, within the same state, sometimes it's pretty easy to do.
Yeah, and I will say that it was, I'm losing my voice. I will say that it was almost a full-time job for me. Trying to take, I ended up reading over 650 tests and trying to track those down and do all of the work that it took. So we had so many bids for testing, anywhere from about $20,000 to $80,000, which was my problem, as I was like, that's such a huge sum of money, while the Department of Utah is offering to do it for free. But then there's also some level of like the amount of work I ended up putting in was astronomical to try to get that done. So I think that's the one thing like I would give people advice about, is really, really talking about, what level of responsibility you have or somebody has from the camp, and do they have the time to do that? Because it ended up being just way bigger than I knew it was going to be big, but it was even bigger that way than I thought it was going to be.
Brandon, I saw you were going to make a comment.
Yeah, thanks. Just been waiting for the right time. Just circling back to the either laws or executive orders from your governor or whatever, because we have one of those governors in Texas as well. And what we have found, and considered a loophole or whatever, is that we can require that before participation that people get a PCR test within 72 hours, and we can give them the option to not have to get the PCR test if they're already vaccinated. So that gives them the option to disclose that they're vaccinated and to provide proof of that. But the only way they can avoid getting the PCR test within 72 hours of participating is to show that they're vaccinated. So we're not exactly asking them to show they're vaccinated. We're asking them to get a PCR test, but they can opt out of that by showing that they're vaccinated. It's a loophole, but it works.
Brandon, did you do any other testing for them then with the people that are vaccinated that acquire COVID? So that you didn't.
That's going to be my question too.
Yeah, so we have not been doing that. We are doing symptom checks upon arrival before they get out of their car. We call it an all access pass, but it goes through all the symptom checklists and asks about every member of their family, and any of the symptoms of COVID and all of that within, the past 7 days, whatever. We ask them to keep a temperature log for 7 to 10 days. So we're doing all of that. And then we're, if they show up and they have a fever, then the whole carload just gets turned around and sent home. If they have sniffles, we will go ahead and do a rapid test, because we do have the Binex now tests on site that we can do rapid tests as needed. But we've also been pretty aggressive with anything that could be contagious illness, just sending them home and just not playing. and no one has well, I can't say no one. In the summer, we had a couple of families who they didn't really complain. They said, we understand, but we're really disappointed. And like, okay, that sure, who wouldn't be disappointed that their child didn't get to stay at camp? And so, nobody got mad and in our face about it, I guess I should say, being that aggressive with sending people home.
And I found the pre-camp screening, we did 10 days of it, as well as just the education surrounding, we need to have a healthy camp. People were really, really good about coming forward to say, hey, I don't feel well or whatever. So, we started with everybody coming in healthy, and the pre-screening, we actually canceled, I think it was 4 or 5 counselors that didn't come, and a couple campers, because they had things that were contagious, whether or not it was COVID or not. It was definitely with somebody with parainfluenza kid. So, I mean, definitely things that you don't want to come into camp at all, and especially in a year with COVID. So,
well, and the really interesting thing, which maybe isn't that surprising, but reaffirming perhaps, is that even your traditional just stomach bugs, just, whether it's H1N1 or, whatever it is that often you have some sort of bout of something at camp, we had none of that this summer. Absolutely none. No spread of anything. And that's pretty awesome. It's kind of like, maybe we should do some of this all the time. We hope we get to a point where we don't have to do all of it all the time, but maybe we should do some of it. One other thing that I thought about that sort of along with those loopholes that I didn't say specifically, I know I did yesterday and I alluded to it. We serve a lot of different conditions and a lot of different disabilities. So we're not entirely cancer. However, one of the policies that we have had in place, that was in place all summer, and we've kept it this fall, even with the governor's executive orders, are that anyone who is considered high risk, according to CDC guidelines, is only eligible if they've been vaccinated. And we by setting that policy, we've been able to get vaccination status because it's a requirement of participation based on US government guidelines. So again, kind of loopholes, but look for them, like if there's a way in the wording, get your attorneys on it. Because if there's a way in the wording to sort of require vaccinations without saying that you're requiring vaccinations, then I think it's worthwhile.
On a little bit different note, those of you that did testing, did you have a minimum platelet requirement for the testing? Like if you were doing nasal swabs or anything, did anyone have issues with?
I just put a disclaimer that said, if you have a lower platelet count or at risk of bleeding, to contact your oncologist to see if nasal swab was appropriate for you, so that I wasn't responsible for making that decision, that their oncologist who knew them well was.
So we did saliva for our pre-PCR. And then the rapid antigen on arrival was a nasal swab, but we actually require all of our kids on therapy to get a blood count before the week of, or like right before. So we kind of knew platelet counts. And we also had decided this year that if kids were severely neutropenic, even if they wanted to come to camp, it was not going to be the year for them to come. So even if they applied, if their result came back showing that they had a low ANC, the parents were already aware that we would be changing, that they would be going to the virtual program and not the in-person.
Do you think, and I was at another session, I haven't gotten to hear Dr. Rafi yet, but do you think that testing is something that's going to be with us this summer? And for those of us who are trying to gear up to be in person versus virtual, how early should we be getting supplies and all of that type of thing for testing?
He didn't talk as much about testing in his talk. At the end, someone did ask him if he thought you should require COVID vaccine to go to camp, and he said yes.
That was me.
Yeah, that's what I thought.
Yeah, I was trying to get that affirmation that we did the right thing. So
yeah, he didn't hesitate. His answer was yes to require vaccines. And obviously, depending on what your laws and lawyers will let you do, but that was an unhesitating answer from him.
I think testing, not that it's the only strategy, Deb, but I think it does give you some sense of security that you're bringing in hopefully a healthy group. You know, obviously, if you do a PCR 3 to 5 days ahead, it's not going to tell you anything about what happened after that. And that's why we chose to do another test on arrival and kind of do a multi-layer. But I think that I envision us doing testing probably at least through 2022 or until this, I think we're gonna be doing testing this year. I would recommend, we really started talking about whether or not we could go in person back in November of 2020 and started working through the field guide put out by the ACA as kind of our working document. But we pulled a team together and had a 2-day retreat. And we just really walked through every aspect of that and talked about how it related to us and, what we might consider doing or how we needed to go about addressing a particular issue. We hadn't made the decision yet if we were even going to be in person, but I definitely would advise that you start kind of working through each one of those kind of sections in the field guide early on and look at how it relates to you, as well as networking now with other camps that have done it. I don't know, Brandon, if you have anything to say on that, but we pulled together not only some of the staff, but we pulled in some of our really strong leadership, our volunteer leadership to sit on this task force, and also some additional medical volunteers as well. And just really had some really great discussions. And I mean, some of these things, they're not easy to answer. It can take you months to figure out what to do. We don't have the best cleaning group at the camp we go to. We hired a professional cleaning company to come in and do deep cleans before each session, and also to come in and do a daily clean. And then we did a second clean for high touch areas ourselves. But, that's the other thing you really have to look at is, do you have the right people doing your cleaning? And I hate to say that we didn't have the best group, but we felt like that was an area we needed to really improve on. We also felt it was going to be difficult to evaluate our air handling system. And so we made a decision to put medical grade air purifiers in any shared housing space.
Susie, I think you had mentioned earlier that when you were talking about the insurance that you worked with 3 states, does your camp serve more than one state? And if so, do people fly to get to you, or are they all driving distance?
No, it's Midwest mostly. It's the camp is based out of Chicago, but we service Illinois, Wisconsin, and then we do have some kids coming from Indiana as well. And we do have some kids who fly in from other states, kids that have started with us and then have moved, but mostly it's Illinois and Wisconsin. And our camp is located in Wisconsin.
Thank you.
Susie, do you guys rent or you own your own campsite?
No, we rent. So that's the other thing is, if you do rent, you have to look at the interactions that you're going to have with the personnel on site, and what are their policies and beliefs too. And so we tended to have love the group, but as far as COVID was concerned, they were doing the things that they needed to do, but they weren't as hip on all the heavy screening and testing and vaccinations and things like that. So we really had to look at how do we work within their small team, but avoid that exposure and contact, and start early talking with them about their policies and things like that. So
I think back to the person who asked about the testing, I would say a couple things. One, I can't foresee that, at least for a while, that the testing's going away. And kind of 2 things. If you're working with a company and you're paying a certain volume to, have them set up your testing and do all of the tracking, then I think get on it as early as you can. The problem I ended up running into is that I set this up with the state of Utah. We had it all arranged. We had a QR code. So all they had to do was show up, scan their QR code, everything registered with Camp Hobie. It sent the stuff to me. I got the results. And then 2 weeks, maybe 2 weeks before camp, before the testing was to start, a ton of those centers shut down. And so nothing that we had set up actually worked. So we'd spent all that time. So there's also a balance between, I think, the policy work. I think creating the policy was worth all of our time because it's certainly something we can use moving forward, regardless of what variant we're dealing with. But I think there's a balance on how much time you put into that, especially if you're working with an organization that could change.
I have a question in relation to testing and wondering how people made the decisions to do the PCR testing and then the rapid testing. I'm just wondering why you wouldn't just do rapid testing, especially because the PCR testing is so cumbersome and so much work and time. I wonder about just doing the screening beforehand and then just doing a PCR test on arrival.
You know, I'll say that we started just doing rapid testing or allowing rapid testing until Delta emerged. And then the sensitivity of the PCR test compared to the rapid test, the viral load that the PCR tests detect is so much more sensitive than the rapid tests that we just felt like we had to start requiring the PCR tests. So that was our decision on that. So it was really end of July, 1st of August that we started requiring PCR tests.
I would have to agree. It's the sensitivity of the test. I mean, the PCR test will pick up at very low levels, even before people probably have symptoms. Sometimes your rapid antigens, you may not even be able to detect it until somebody's actually more symptomatic. The company that we work with actually said, if you're going to go with rapid, they say you need to do a series of rapids daily in a row in order to really feel secure in knowing that you don't have COVID present. The particular company that we work has an infectious disease physician on their staff. And so we had a unique situation in that we had a camper coming to summer camp from England. And so we had to handle his coming into camp a little differently because of him traveling international and, you know, what kind of testing do we need to do? And so with our agreement, we actually had that consultation to be able to provide a very individualized plan just for this particular camper. So that was nice. And they also are available 24 hours a day. If you have a case that of COVID that comes up, they'll actually work through it with you as far as your contact tracing and just everything that you need to do related to that. So. There's a number of labs too that are, so I looked at working just directly with a lab, and some of the prices for to go through the lab and have them file insurance and stuff like that, there was still quite a high cost associated with that. But as more and more, as this goes on longer, there may be some particular labs out there. Like I know I'm constantly getting stuff from Vault Lab to see if I want to do testing through them. So there are different labs that might be willing to work with you in your area as well.
So just putting my camp director hat on, do any of you have an idea of how much of the budget or what a chunk of your budget ended up being related to testing and COVID supplies and all the extra, you know, Susie, you talked about, you know, cleaning groups, just trying to think about what kind of a chunk of money do I need to set aside if we're in person for this?
I can get you those exact numbers, Deb, if you want. Obviously, I'd kind of watch your supplies. I found Costco was a great place to go for supplies. We paid for masks and stuff, but you know, if you watch Costco, sometimes their box of 50 masks go down to $6.99 a box. So if you kind of keep an eye out for that, I did N95s for them just to have available. And when I purchased the N95s, they were quite high. They've gone down significantly in price as well. I did not have any trouble getting supplies. I don't know about anybody else, but I tended to try to just search around and find the cheapest things that I could find. Hand sanitizer now is cheap. So, I mean, you know, all that kind of stuff, but it does take an awful lot. We overbought. I'll be honest. We have more than we actually needed. of paper towels and, you know, in the shortage. Every time I went to Costco, I picked up a thing of paper towels. We got more paper towels at camp now than we probably get us through the whole next year, if not longer, but I can get you some exact numbers.
So I have a question for your in-person camps. Like, was it overnight? Do you do
Yes.
overnight? And so do you require then the campers and staff to wear the disposable one per day, or like, what is your policy on that?
So we planned out 2 per day. We had more if we needed it. If they were indoors, the masks needed to be on unless they were eating, you know, or sleeping or whatever. But we really tried to eat and drink outdoors. We had tents set up all over campus. And I think a lot of people did move some of that activity outdoors. But if they were indoors, they did wear their mask. Even if they were with the cohort, you know, we weren't there long enough to like retest halfway through the week and say, everybody's good, you can take your mask off. And even though the CDC came out and said, if you're in your cohort, you don't have to wear a mask, we didn't like that very well. And so we kept masks on with indoors, or if they were in closer contact than 6 feet. Our staff, I don't know, went round and round with my medical advisory committee. We even had the staff wear masks outdoors. I actually wanted to let that be a little looser, but the team as a whole decided that the staff should just wear the masks all the time and set a really good example. We lucked out, the weather wasn't really hot, so it wasn't such a huge drain for everybody, but that's what we did.
Did anybody we had 2 sessions in person, and this came up at one of our camps. Did anybody have to deal with any ADA exemptions around their masks? We had a participant who is deaf. And so of course, having all of our participants be required to wear masks at all time, it created quite the obstacles and hurdles for this particular participant.
We did not have to deal with that, Jen, this summer.
Nor did we.
So again, we serve a different population than most, but also because of our governor's executive order, there were, you had to allow medical exemptions. And so for our campers with autism who have sensory issues with having masks on their face, we couldn't require masks. So we had a lot of campers who just, because of their disability, could not wear masks. And it, it worked out fine. So we kept everybody cohorted. Go ahead.
Did you just allow the people who with the exemptions to not wear masks, or campus wide, nobody was required to then kind of for inclusion? And
no, we essentially encouraged everyone to wear masks if they could. And then there were those that we know could not. And there were some who probably could, but still chose not to. And for, behavioral reasons, because of their disability, we did not try to engage with them on that. But we were very conscious of cohorts, and they were socially distanced from other cabin groups at all times. They were only unmasked in a closer proximity with their own cabin group.
I know some of the schools, because we have a couple of teachers on our in our leadership group, and some of the schools were using those clear masks, which, I mean, I know when we go to the hospital, we think it all has to be medical grade. So I don't know how they compare, but at least then they can see the facial expressions, and that might help with your camper who was.
That's ultimately, we found some on Amazon and had ordered some and made them available to people that wanted them, but didn't require that was the mask that people wore. And essentially we just ran into, it was almost worthless because they fog up so bad.
When they're so expensive.
I will say that one other thing that we did is that we we had plenty of disposable ones as needed, but we bought 3-ply cotton masks with the camp logo printed on them. And we printed it as sort of like it was on a white mask, just sort of a coloring book logo. And then we had them tie-dye or decorate them in arts and crafts. So it became kind of a cool camp swag thing that they wanted to wear those masks. So that's one way of encouraging people, if you have it in your budget, to brand it. And then, some of our nurses also found some disposable tie-dye masks that fit our summer music festival theme really well this past summer. And then all the campers were like, ooh, can I get one of those to wear? And so sometimes if you make it cool and fun, then it makes them more willing to do it. But the other thing that we found as time went on, and especially we're finding this fall, is that a lot of kids are used to wearing them in school now, even though in Texas schools can't require it because of our governor again. But it is something that a lot are still wearing them, and they're used to it, and it's been less of a hassle than I expected it to be.
We found that they sometimes had them on a lot more than they needed to. And it's like, I'd go around in the golf cart and I'd say, hey guys, good to see you. You can have your mask down. Oh, it's okay. It's okay. We're okay. They were in their cohort or whatever. They didn't seem to really care about having them up. So, and they were outdoors. The campers should have been able to have them off outdoors, but they just kept them on. One of the things, and I think we said this in other sessions, but in case you haven't been there, we talked about cohorting. There was definitely some benefits of the cohorting that we found. The kids came in, the new kids came in and acclimated much easier. There was a lot of connectedness, that real kind of supportive network of this small group of campers that lived and played and did everything together. We did not see a lot of high anxiety. It really was a great way to, I don't know, it worked out really well. So if we're looking as we move forward and going back, someday, we're looking at always having those smaller groups within the larger age specific group, just because of how well the kids bonded together and shared and communicated and connected. And the counselors just felt like they got to know the kids better. Were able to track issues a little bit better if there were any. So.
Can I ask a question? I just have to say, I applaud everyone that pulled it off safely. Because I feel sometimes I feel like, am I just being ridiculous about this? Like with our things that are our limitations we put in place. But I guess thinking of it as, I'm an ICU nurse, and we always tend to think of things as the worst case scenario, and like, what's the worst? So is there anybody that had a bad experience that they'd be willing to share, that was like, this did not go well and I wish we had done it differently? Or because I love everything you guys have said, some great stuff, but I'm just wondering, like, is there anything that didn't go well?
Our dining was a disaster. I mean, it really was.
Was it indoors or outdoors, or?
It was outdoors. It was all prepackaged. Again, we had talked through all this, but things were getting kind of messed up, and we recognized pretty early on that there wasn't any separation between some of our kids with allergies. We had to do a lot of on the spot kind of navigating with, and again, we were working with the kitchen staff of the place we rent from. We thought we had done all the preparations, but we were very lucky that we did not have an allergic reaction. We did get it fixed fairly soon into it, but it was a complete disaster. Everything was prepackaged. You'd have your cohort leaders go and pick up the food that the kids had ordered, take it back, but gluten-free kids had gluten stuff. And so, yes, that was a disaster. And we're now talking about how that's not going to be a disaster and what we need to do as we are potentially thinking about holding a winter camp. And just to your comment, Tammy, I will say I sweat every single program we're going to have. And I worry every single program. So it's,
Yeah,
it's trying to look at balancing the mental health needs of the campers with the safety needs. And I just keep reminding myself that I have about 10 to 12 layers of safety strategies that I put into place to try to keep everybody healthy. And we can do that, but we revisit every single program. And we made a call to open applications for an in-person winter camp between Christmas and New Year's, but we're making a final call the 1st of December because rates are starting to go up again. So we hit a really sweet spot this summer. It was like that 3rd week in July, right before things upticked, and rates were very low. We were lucky. So
that's
yeah,
how we were this summer, because we had, by the end of it, a few people, a lot of people had actually pulled off camp, and we're at the end of August. And we were thinking, oh gosh, maybe we missed an opportunity, but that's when Delta just went. Whew.
Yep.
So
I worry about
dodged
this
that.
Delta 4.
Yeah.
So
On the
I
camps
definitely have
that
more gray
happened,
hairs than I did.
yeah, there was a lot of crying for me. I will say there was a lot of crying over like were we doing the right thing. It ended up being wonderful, but I think the stress is real. And I will say that there were other camps that went the same time as our camp did in our area. And I came back and cried some more because there were so many outbreaks at those camps. And then looking at kind of what they did compared to what I think of all of our camps too, because of our population and how I think we're just an incredibly thoughtful group of people that are involved with these type of camps. And they didn't wear masks, they didn't cohort, they didn't, none of those things were required at the camps that did have the breakouts. And so I think it is really reassuring at how thorough just, COCA and all of the type of camps that are here are in keeping these kids safe and how serious we do take it. And I think that's why we had camps that were able to pull it off, is because it was no small feat. And I don't think, I think being worried about it is the right thing to be if you're going to move forward with an in-person.
I appreciate your honesty. Thank you.
And we cut numbers. We didn't have the same size groups. We normally sometimes have 220 kids on campus at once. We actually had 90, I think, one session and 75 the other. So a much different, we had set our capacity at 100 per session, just because we knew we couldn't run this high volume. So we are not back up to full capacity. And even for our winter camp that normally hosts about 100 kids, I said max is 70. I think we're going to land at 50, which I'm perfectly fine with.
I don't know if this may be the researcher in me that's a little too nerdy, but is it something that would be of interest to people, or is it even possible to have some kind of like reporting database of what people did last summer? Because when I listen to people tell their stories about camps that they've done, it all is a little relative sometimes as to, like you said, are you at full capacity? What is your full capacity? What are your cabins like? What are your cohorts like? And I just wonder if like there's a way to make a big old Excel spreadsheet that people could just go in and fill in their numbers, just to have some kind of comparison so that you could know which camp to call. Maybe if you wanted to compare how people did something. Again, it's probably way more than anybody wants to do. But those are the questions that go through my mind every time I listen to someone talk about their experiences. I want real details.
I think that would be really interesting. I think there are so many apples to oranges because of the, it would be a coding nightmare to try to figure out how to code it into the database. But it would be fascinating, to be able to see those comparisons if you could figure out how to code it so that you could compare it.
We need a program analyst to kind of like.
Yeah. Tammy, I'll say, just kind of back to your other question. I'm always happy to be honest about the good, bad, and the ugly. And honestly, we didn't have much ugly, which is great. I mean, I think that I got to the end of the summer and was like, whew, I felt so much relief because we didn't have a lot of ugly. Like for us, the ugly was financial. We ran at 65% capacity pretty much. And it was an extra $500 per camper that really cost us. And luckily we had PPP loans and things that this year we came out okay financially as we're getting to the year end, but it's not financially sustainable for us as an organization for years into the future. So while we've been working on budget for next year, we've really had to look incredibly closely at those kinds of questions. So the biggest ugly is financial. I will say, like Susie, with dining, we didn't have as many issues as she described that they had, but we had logistics challenges because we decided to eat in shifts, so that we did 2 meal times for every mealtime, and we did like major cleaning with electrostatic sprayers between group, like we did all of the things, and it was a lot of work. It was a lot of logistics, putting together the schedule. And then at the same time, there were benefits to it, like the dining hall wasn't quite as crazy and chaotic because we didn't cram 350 people in there at a time. We only had 200 people to begin with, and then we only had 100 in the dining hall at a time. And so it was a lot more peaceful, and people maybe enjoyed their meals more. I don't know, like there was still enough energy that you had that crazy camp feel, but it wasn't as overwhelming as it can be sometimes. So I think that all of this has taught us that there are pluses and minuses all across the board, and there are silver linings in every cloud. Say it however you want to say it, but we sometimes we feel like it's by the grace of God that we made it to where we are, and that we keep making it to where we are. But even one of our founders from 43 now, going on years ago, who is a physician, who is still practicing, who is on our board again right now, and was on our medical advisory team as we were deciding what we do. He said, if we didn't take risks 43 years ago to say that kids on ventilators should come to camp, this organization would have never started. And at some point in time, we have to decide what is an acceptable level of risk. And is camp more important than the risk? And some of that question has to be answered by the families, but we have to decide when we're ready to offer the opportunities. And there were certainly plenty of people on those calls that were more conservative than he was about when we were ready to accept that risk. But it was a good reminder to recognize, go back, 35, 40 years to the first, I guess, ROT camp was the first children's cancer camp. And go back to that, and they were taking a risk to take kids on treatment and send them out to a camp, and what so it's all a matter of figuring out what's acceptable and what's not.
Did anybody budget in for alcohol and massages for the staff after you were done?
I didn't, but I'm drinking some wine tonight.
Excellent. Thank you all for your comments. I'd ask Dr. K and Mary Ellen, do you have any final thoughts for the group?
I just wanted to take the opportunity to thank everyone for sharing all of your experiences and being willing to speak up and talk about what you did. And also, excuse me, if you have ideas of other things that you want, Tammy, your point about getting a repository for COVID, your idea to get all the details about camps sounds overwhelming but necessary, so that might be something we need to tackle. But if you have other ideas, webinars you think COCA maybe could do in the upcoming months, shoot myself or Mary Ellen a message, and we'll try to see if we can come up with a way to address that need.
We need a good grad student. Anyone
Yes,
who
we
has
do.
a good grad student.
I was thinking, does anyone have a grad student or an intern or someone who made the project? Because this would be a great one.
This would be great. Yeah. And from a purely selfish standpoint, COCA is going to be in Delaware next year, God willing, knock on wood. So we would love to have your suggestions for medical topics for next year. So shoot me an email, catch me in a session or something, but we'd love to have your ideas.
Excellent. Thank you, ladies. It's been a wonderful night. So glad we were able to have this. This is a continuing education session, so if you do want to receive your continuing education credits, please remember to fill out the evaluation that you have to get your credits. And Mary Ellen, what, they should expect their certificate in about a week or so?
Yeah, within the week of the conference ending, we'll get everything tallied up and you'll receive it by email.
Perfect. Thank you. Thank you guys all for attending. And that link is in the chat if you need it.
And cheers to Mary Ellen and Teresa for getting all that done and getting it done so quickly. I mean, it's honestly amazing.
Yeah.
Seriously.
Thank you.
Dave, you have a comment?
Now, can we get credits if we watch it afterwards, or do you have to be participating?
Yeah, you absolutely can, as long as you fill out the eval. Absolutely.
Okay. So when I went to that link, it was the beads session. Do I just fill out the ones I attended? Is that how it works?
Yep, you just fill out the ones you attended, correct.
Okay. And just on a side note, tomorrow is my 1-year anniversary for catching COVID. I caught it on November 11th.
Oh, wow.
God bless.
We're
Wow.
happy you're here.
It was not a fun week. It was not a fun week afterwards. So
I have a
very
quick
good
question.
information.
Quick
What's that?
question about doing the evaluations. Sorry to interrupt. I've been doing them as I go, but you can't actually save them. Is that right? Because it looks like it just goes into the next day.
Brandon, you talked about that last night, remember?
So I've had the survey open and just haven't closed it and haven't gone all
That's
the
what
way to
I've
the
been
end.
doing. Okay.
And it looks like if I go back to previous at the bottom of each one, I think that it's still maintaining my answers.
Okay.
So I decided to just like keep it open and
keep it
just
up.
do it all at once.
Okay, that's what I've done so far because I didn't think it would save it if I logged out.
Yep.
Thank you.
Looks like we have another question from Becky.
Yeah, is there a due date for having that evaluation in? You said within a week you'll have those certificates out.
Yeah, so I mean, the sooner you get the eval back, obviously, then we can get the certificates out.
Okay.
But you've got my email address, so just send it to me when you can, and I'll get them done.
I
Okay,
guess
great.
that does bring up a question, Mary Ellen, that I feel like, and I may have misheard this, but I feel like in one of the sessions, maybe either Don or Jennifer had mentioned, oh, these recordings will be available till February. You can do it anytime. That keeps it open-ended for you for a long time. Is that not true? And do we need to make sure that people know that there's a deadline by which to get CEUs, they have to have it done?
I mean, I would really like to kind of close it down within a month of the last of tomorrow. To be honest with you, I didn't know they were putting that time frame on it. That was a surprise to me.
Okay.
So yeah. So I mean, I'll talk to